Hello, everybody, and welcome to another episode of the Healthcare Education Transformation Podcast. I'm your host, F Scott Feil, and we are joined today due to a state of emergency. The whole nation is currently undergoing the coronavirus pandemic, and we've been fortunate enough to be joined by some of the foremost experts in online education. These guys have been doing it for a while now. They are well-versed in how to transition from face-to-face, in-person teaching to more of an online setup. And we're here today just to have a little talk about things that you can do to prepare yourself for that, how to make the transition, how to excel at teaching online, because most of the universities across the country have gone to a completely online method and model for the next rest of the year, or at least, throughout their semester. So I'd like to introduce Dr. Gagnon, Dr. Blackinton, and Dr. Shepard. Guys, welcome, and thank you so much for taking time out of your quarantined day to help chat a little bit about all things online academia. I'd like to start first with just a very simple question. How are you guys handling this? Don't all jump at once.
I'll start, and I think that, what I've been talking about with my colleagues across the country is that as leaders in higher education, we have to be that duck on water, right? So on the surface, we're staying calm and trying to use the principles of, good teaching and learning. So whether you call that pedagogy or andragogy, I think we're trying to stay calm. The truth of the matter is that even for those of us that were already blended, because we're losing the face-to-face portion for an uncertain period of time, we too are adjusting to a new COVID-19 world. And that, in my opinion, both as a leader and an instructor, I think it takes, a good deep breath. I think it takes creativity to a degree, and being open to new ideas and new strategies. And whether this is brand new for you or whether you've already been in it, I think that mindset is what we need to move forward.
Yeah, so in our program, we are a hybrid program, and the timing for us is that kind of this move to online happened right at the end of one of our lab immersions and beginning of a block of online instruction. So in terms of timing, I think we're pretty blessed that we sort of got timing where, it also happened for us right at the end of our students' clinical internship. So we didn't have any students pulled for more than a day or two. So for us, we've had we already were online. We were already planning on teaching online for the next 6 weeks. So in that way, we've sort of had the luxury that a lot of folks haven't had to sort of continue on. And we are, though, making contingency plans for what was supposed to be scheduled for our immersion lab in April. We've already had to cancel that and move that. So that's sort of been the big discussions among our faculty. I almost said our family, but our faculty is almost like a family, especially right now. So I think it's like those things are blending together for me. But I also, I'm the director of student affairs in our program. And so I think for me, the biggest thing that I've been working on this week is that student support piece. We have 2 cohorts of 100 students in over 30 states across the country. And I'm happy to report that most of our students seem to be minimally impacted at this point, in meaning that they're able to kind of figure it out and move on. But we do have students that are more than minimally impacted and that have all sorts of different individualized issues. So a big issue we're having, even with the online instruction that we'd already planned, is that balance between keeping the normalcy and the schedule and keeping on track, but also providing that leniency and the ability to kind of pause and figure this thing out.
And I think from my vantage point, being involved with the post-professional side of a hybrid fellowship program, it's just as was mentioned earlier, about trying to stay calm and stay, really level set here. It's been interesting because the fellows in training in the program I work with is, there's just so many different practice settings they're in. I've heard from several of them who are, just not sure what's going to happen with their jobs because their clinics have closed. Some of them, they don't know for how long. So what I'm trying to manage here is, what Kendra and I really talk a lot about is, how do we humanize this piece? Because we have, our own goals. The program must go on, but then we have these individuals, participants in our program who, they say, look, I don't know what's going to happen with my coursework, going on if I'm not in clinic. We're a clinical based program. So, my heart and my mind has been very consumed with just the realness of this. And I can tell you the clinic hours I've had, even though they're minimal, I've had to basically give them away, and I don't honestly want to be doing patient care right now just to try to uphold, social distancing, but it is very strange and scary. I'll be completely honest from my vantage point.
Yeah, that's such a great point, Mark. I mean, humanizing this whole thing at the end of the day, really, that should default into our first step, I think, and method, because I mean, I've been working home health for a couple of years now, and that took a huge hit when Medicare came around and PDGM. The numbers dwindled. I saw a bunch of PTAs get fired. And then when coronavirus came, the COVID-19 came in, it just, assisted living facilities aren't allowing visitors, and rightfully so. I see it could be very difficult as a home health practitioner not to be concerned about your patients, not to be concerned about yourself and your family, because you become a higher risk as a carrier, traveling from home to home to home. And of course, we take every precaution we can. And, wiping down your equipment and setting up clean workstations and washing your hands and sanitizing, and it seems like I've dried up from all the alcohol that I'm using lately. My hands are dry and cracking, and it's my equipment is squeaky clean at this point. So we're doing all that we can, but at the same time there is that human element of like we've got to do the best thing we can for our patients, for our students, for our families. So I can definitely see not wanting to just dive into the clinic and see a bunch of patients right now, for sure. Well, let's look at this first question then. You've been moved to an online program for the rest of the semester. You were normally a in-person, face-to-face, brick and mortar school. What should faculty be looking at as far as maybe equipment or readiness or preparedness, things that they might need to move to this online hybrid type setting for the rest of the semester?
Yeah, I guess I can jump in. I think, the first thing that I would say to faculty is that, this is not really online education, because you're doing in a week what it has taken many of us that work in these environments years of frustrations, failure, trial, error, mistakes, and you're doing all of that in a week. And so, and also probably without a lot of the kind of tools and technology support and platforms that a program that's built from the ground up to be hybrid or online has.
Right.
So
literally emergency preparedness and bare bones minimum. All right.
So I think just being a little bit gentle on yourself and doing the best you can is kind of the first thing I would tell faculty. I think there's a lot of really substitution level stuff you can do that people are probably already doing. Record your lectures, post discussion boards, post documents, readings. But again, to Mark's point, I think that there are tools that are readily available that you don't have to be a tech expert to use that can really humanize. So as Mary mentioned as well, Zoom has a free platform that you can use to do group face-to-face meetings. And if you are, and even just doing those touch points once a week, posting those recorded videos and then doing a quick Q&A or once a week will help those students, I think, have that human connection and also process and be able to ask questions and dig a little bit deeper into the learning. And if your students don't have the, bandwidth, internet speed to do live classes, there are some really great asynchronous video platforms, including Flipgrid is one that I really love. Not sponsored, but I just love that platform a lot. And that one seems to be, it's asynchronous, so it doesn't require quite the bandwidth and internet speed, and most students can use it on their phone. So a couple of really easy things you can do that don't require you to totally flip things on its head and I think be a tech expert, because obviously there's a lot of cognitive load in learning the tech as well.
And I agree with everything that Kendra said. And I would say that, I've been talking to people about this. Most people are going immediately to Zoom and doing a live session because it feels really comfortable because you're used to doing live sessions. And I think that that is an easy button to push. The problem that our university is finding is that it's not as easy as it may seem, because although you can do it and give everybody the link, there are complications in terms of the overall connectivity of the internet. So because I'm a program that has done asynchronous, I'm very comfortable with it. I think from a countrywide perspective there, and you've got to meet today's needs, but then it's possible to maybe use a combination of synchronous and asynchronous. Because, Saturday, somebody can record 3 sessions, get them ready for next week, and they're not going to be perfect. I think that's a really big thing I've been trying to message. You've got to let go of perfectionism. It's okay to cough and sneeze and the dog barks and your kids go, Mom, it's all right. Because you know what? That makes us, speaking of humanness, it makes us human. And you should never think that a recorded session, whether it's a podcast like this, Scott, as you know, or any other session, is perfect. And if we can all embrace that, the stress will go down. I think, we've always talked about the community of inquiry model, meaning that, in a blended or online program, you want social presence, teaching presence, and cognitive presence. And I add psychomotor for PTs. So there are really simple ways that you could add teaching presence is your leadership. You go on and make an announcement every week, whether it's your voice or your video, and say, hey guys, all right, we're in our new normal. I hope you're all doing well. Make a personal, reach out to every student in a group format personally. And then show your teaching leadership as well by being organized. Here's your to-do list for the week. And then social presence, ask students to get together offline and work on a case and then get back together. And cognitive and psychomotor presence means bringing in good cases, good teaching that we're all already doing. Some of us blended, but some of us face-to-face, and bring them into the online format to give students active learning experiences. Don't make them just watch and watch and watch. Give them something to do. You don't have to grade it necessarily, but engage them. And I think they will feel more engaged and you'll feel more comfortable with what's going on.
Those are excellent points. And I think, Mary, your point about perfection really hits home. And, I think Kendra and I kind of laugh, because we've developed plenty of online, as I'm sure you have, Mary. And, it's hard, especially this day and age. Everybody's stuck at home. Your kids are most likely stuck at home. You're going to be with your pets probably too. And, there's going to be a bark in the background when you're recording something or doing a live session. There's going to be kids who come in or sounds or things that make you feel like, oh, this is unprofessional. And I think you kind of have to put that aside. I think students actually like it. The reviews I've heard from times when that's happened to me has been, I really liked, that the realness of the person who's coming through. And I think that really was something that took me aback and being like, wow, that was probably one of the worst lectures I thought because of whatever happened. And, I just didn't have the time to redo it because otherwise you would be doing it over and over and over again. And I think Mary said, one of the easiest things is the asynchronous piece, because you probably have lectures that are already prepped to go week to week to week, and you can flip those. But what I would say from my vantage point, I think we would all probably agree is, flipping your content isn't easy, just as easy as doing that. I think when it comes to lectures, one of the tips or tools I've really tried to adhere to is really keeping the lectures very short and bite-sized. With students these days, we think about a normal traditional brick and mortar layout where you may have an hour, 50 minutes, hours, sometimes longer to do lecture-based time. And not all that time is sometimes dedicated to, sage on the stage type stuff. But I would say, when you're flipping your content, particular any PowerPoint based stuff, if you're doing it in classroom for 30, 45 minutes, don't record it for 30, 45 minutes. Try to break it up as best you can. And if you do a live session, the big thing that I struggled with, and I see faculty struggle with, is re-lecturing things you recorded. And so if you think about scaffolding within the week, you want to make sure that your asynchronous or recorded content is different from your live or synchronous content. So think about ways, as Mary was saying, make it active. If you're doing something through Zoom, you want to make sure that people are engaged. It's really hard talking to a computer when you don't have people out, around you. And so when I do live sessions, I pick my computer up, I put it up as high as I can. I'm standing up, I am moving around as if I am in front of a classroom, because otherwise you fall flat, you lose students way easier. And if you're re-lecturing what you did, and you're asynchronous, you're going to lose students right away. So I think easy things to do: break up your lectures as best you can, and try to expand or add depth to your content in a live session.
And, one of the things that all of this is making me think about is in our hybrid model, we built our model to think about what is it that the only things we can do together here face to face. And that's what we do face to face. And I think you could kind of apply that here as you're thinking about moving your course to online. So to Mark's point about don't re-lecture, content delivery does not need to happen face to face, whether online or in a lab environment. So use that time for the things that really need to happen with you all there together. So yeah, discussion of cases and breakout groups and all those kinds of things can be really effective. And, and I was also thinking about, when Mary talked about all the different types of presence and teaching presence, I think right now that's so important, that leadership. I mean, I just really love that, but also thinking about when you're making those announcements and kicking those things out to students, think as much as you can about using video, because again, I think just seeing your face and hearing your voice, even if you're in, the perfectionism issue, even if you're in sweats with your hair back, it's okay. If you're sitting in your car waiting for something real quick, it's okay, but just a quick video of like, hey guys, how's everybody doing? Here's what we're going to do this week. Let go of the perfectionism. And to me, one of the hardest things when I transitioned to online was getting like comfortable with myself on video, if I'm really honest. And now I'll like record a video anywhere, any place. So just like let go of that and get really comfortable, because your students are just they're gonna love that connection of seeing your face and hearing your voice.
And I think I would totally agree, Kendra. And I think that one way to do that is to consider, when you do that, flip the classroom and keep the really high impact things for when you're synchronous. You don't always have to be synchronous with all 40, 50, or 100 people. We're learning to use Zoom in a different way than we've used it before. So we're playing with each other with faculty right now. We're trying like breakout rooms, and we will put the student in rooms and we'll rotate different faculty and lab assistants between the rooms for that live time, so that when we dissect a case, it's not 1 in 40, it's 1 in 7 people, or 1 in 10, depending on how in-depth the case is. So those are things I think to make people feel like they're getting personal. They're actually going to get a little bit more personal instruction to me in this new world that we're in than they did. And I think all faculty are capable of doing it. Just think about rooms in Zoom rather than groups in your classroom.
Yeah, great points, all of you. I'd like to add a hashtag hoodie, as I am in my sweatshirt and hoodie today and quite comfortable.
Same here.
Yep. And it is what it is. I mean, we're just real life in it right now. So I want to make this valuable for our audience on both sides, because we have listeners that are students and we have listeners that are faculty. And so, Mary, you made some good points there with faculty having to get comfortable. And I want to come back to that towards the end of this episode. But right now, I want you guys to kind of think a little bit on the other side of the spectrum. What are students having to deal with going through all this? What are some of the pros and cons that students are seeing going to an online model over the next however long it may be?
So I think, started to talk about this a little bit before. Again, our students are used to this model, but I will tell you, even when we aren't in a time of crisis, online education, remote learning can often be isolating and lonely. And so that's actually something, my role in our program is Director of Student Affairs, and I work with students a lot on those issues of, how do they become self-motivated, set up a schedule, make sure they have the supports they need, both, their own family and social supports in their own communities, but also helping professionals in their communities if they need counseling and things like that. And so what I think I've seen this week is that those issues are just multiplying. Students are just feeling, even though they're used to this environment, they are feeling uncertain. All of the uncertainty and anxiousness and helplessness and lack of control, we're all feeling. And then some of them have these very highly individualized issues where, maybe their spouse has experienced a layoff and their kids are home and they're figuring out how they're going to be, be able to work through the program, or they've got family or friends that are stuck places that can't travel. So their support people are separated from them or need to be because of their own health and safety. So what I've really been trying to tell our students and kind of working between our students and faculty is I just don't think we can over communicate with each other right now. Our students, our program is organized into academic teams, and each academic team of students, it's 8 to 10 students that has a faculty coach. So we are really encouraging our students to stay in close contact with their faculty coach, elevating those issues up through me to the program director, down to the students. I've been talking with a lot of students. We've got a student assistance program that our students can utilize to get face-to-face counseling in their communities, or if those community-based counselors are doing telehealth, however they're delivering those services, they can access those. And so I think, what I would just encourage faculty too, and I'm sure that this is all very front of mind, is, remember again that our students are, this isn't just a matter of moving our courses online. Our students are dealing with really serious issues that are impacting their ability to learn. And so we have to kind of, again, balancing that, sticking to a schedule and sense of normalcy with understanding that nothing is normal. And we've all got these individual issues we've got to manage right now, and helping support our students in that so they can be successful and continue to learn.
Yeah, and I love that. And I think that communication, I think it's like the 3 C's. So communication, compassion, and community. So communicate, that is something that as faculty, that's our responsibility. Let's keep communicating, keep the doors open. But students also need to know that if they're struggling, they should communicate to their faculty. And faculty, on the other hand, also have to listen and respond with compassion. And, we have, typically strict dress code policies, policies on every level, because of course we're professional programs, but we have many students who are parents and working at home. And so I think responding with compassion, I've had a few people text me and say, I don't know if I can keep my kids in a separate room. And I said, we understand that, and we're going to respond to you with compassion, and do your best that you can, but we're not, again, expecting, it's new for everyone. And then I think community, we have to build community together. So students reaching out to other students, they already have, a lot of them have Facebook pages. We have a student center, an online, a course management system just to communicate. But, maybe we need to more formalize, create buddy systems and things like that to support students. But I think students need to know that everybody needs to reach out to each other to form a sense of community. Our new normal means doing that and being pretty vigilant about it to make sure everybody's okay. To maybe your study group now becomes a completely different group of people, or you have multiple online study groups.
Yeah, and I think, I kind of alluded to earlier, just, from my experience with DPT students, the anxieties, with just the pressures of being in a PT program, or there, regardless if you're in online or brick and mortar. And, I think Kendra's points are super super important to consider. And Mary, your thoughts on communication and compassion are so important. And I think the listener really needs to reflect on that piece there. But from a student standpoint, and even from a clinician, because I deal with the post-professional side as well, is just, understanding that life is happening outside of our classroom walls, digital or brick and mortar, and having that empathy for what's going on, and the compassion piece is something that I think is important. And I think communication of that is really important too. Example of what I typically do: on every Friday, I will send out a message, just on whatever is in my mind. And obviously with the news the past couple of weeks, this discussion on the virus has been top of mind. And so I think, relating to the students that, I know you guys are anxious. I'm anxious too. I don't know what the future holds for a lot of these things. And I know, there's a lot of stressors, but we'll get through this. We'll work through this. We'll be together through this whole process. And, I would say from a student standpoint is to understand that we are, in a unique situation with different pressures too. And I think if we, are forgiving of people for what happens at certain times, I think that's important. Obviously we have competencies and standards and rigor that need to be met, but we have to look at ways to accommodate as many individuals as we can in this time, because we're in crisis, and there's a lot of things that are just happening that we never probably thought we'd have to deal with at this magnitude, at this speed. And so it's one of those things I think we just need to be mindful of, both on the faculty and student side.
And, it really reminds me, when I was a junior faculty, one of my mentors said to me, Kendra, there are no emergencies in education. And that's something that I've just been continuing to sort of remember and think about. Obviously, this is all very serious, and what we're doing in education is incredibly important and necessary, but there are no emergencies. Everything is figure-outable, to quote a recently popular book, right? We can, and that's what I keep kind of telling our students: let us know what's going on, and we'll figure out a way to get it done, and to work together to get through this and get to the other side of this. And so, I think that's another kind of blessing that we have in education, that we have all of these multimedia platforms that we can use. We have flexibility. We're able to accommodate. And in some ways, we're having to do that right now in real time, because as much as we're trying to plan, we don't know what's happening tomorrow or next week or in a month or 2 months. So as long as we just keep communicating with each other and working together, we'll all get to the other side of this for sure.
Yeah, great points. I just want to take a minute to thank you guys for being so flexible and for being able to come together on this little state of emergency episode, because we are such a hands-on field, right? Because we are such a, connection, people to people type profession. I think it is a little bit tough to somewhat come to terms of, a lot of this stuff's going to have to move to online now. So you guys have been doing it for a while. Let's go back to the very beginning of your journeys with online education. Let's say it's you're a brick and mortar school, you're in this emergency scenario, you're moved online for the rest of the semester. Bringing it back full circle to the faculty side of things again, what are some of the best tips, tricks, pointers, things that you can put out there for faculty or who are having to make this transition if they've never done it before and they're just getting started?
Yeah, I would say for me, my big piece is less is more. I think oftentimes when it comes to technology, a lot of institutions have, shiny tech tools, if you will, that, when I was going into the hybrid environment, especially in entry-level program, there was a lot of options for cool things to use: Flipgrid, Bongo, Zoom, whatever you're using. Your LMS typically has a lot of cool plugins and features too. And I went just, crazy with them all. I had every type of thing in there. I had every type of assessment that you could possibly want to do. And what I realized is I was veering away from my learning objectives. And so if you keep your learning objectives at top of mind, even as you transition to this time, if you're going from brick and mortar traditional model to online, which many of us are obviously, look at your learning objectives and let those be your guide. And then understand that less technology is sometimes better, because you're decreasing the cognitive load that students need to basically learn and use. Because a lot of times, even though students are pretty quick at adapting because they're used to technology, we have to remember that there's anxieties around learning new things right now. So it's just like motor learning. If your stress response is going on, you're not getting sleep, they're dealing with the same motor learning issues, just now with technology learning. So I think, keeping it simple, keeping less is something that I've learned more and more. You trim the fat and be very intentional based off of learning objectives.
I agree 100%, Mark. And I would say a couple of additional things. First of all, there is a myth out there that because someone is millennial or a certain age, that they are a digital learner. And there's a really good article, and Scott, I'll share it with you so that you can post it, called "The Myths of the Digital Native and the Multitasker." And I think that we have to, one of the biggest eye-opening things for me when I started doing blended learning was that it's other than people posting on Facebook and Instagram, the skills that you need can be complicated for people that are on Instagram. So I think acknowledging that, and that everyone's going to struggle with the technology. But in particular, I think the area that's, that everyone, including myself, originally was worried about was psychomotor skill development. So I would say if you're starting from scratch, use the technology that you have to create, as Mark said, short, very focused demonstration videos. If you don't have the bandwidth to create it, there's YouTube. There's a program called ICE. I know our university has it. They are demonstration videos that are already there. Or maybe as colleagues across the United States, we can share with one another. Wouldn't that be awesome that we get out of our separateness and come together and start sharing some video resources? But I would say keep those videos short, and you can talk to the student while you're videoing. Let's say you're doing a technique, you can be, moving and talking, or you can have a video. Like sometimes if I'm doing something like where someone's moving in bed, I'll take the YouTube, I'll record the video, and I'll talk over it. And again, I do that asynchronously through screen capture, but you could do that live in Zoom. But again, focusing on what you would in a classroom, but very simply, pay attention to the position of the therapist's body. Notice the hand placement. Notice how the patient's hand is not grabbing, it's cuffed. So and you don't have to show everything. You don't have to show every item. You can show general principles and then give students assignments that they have to try in their environment. And to that, we're kind of trying to come up with some guidelines. So, for students, they've always needed their video camera, but is it possible that we need them to get a patient? And if they're completely socially distanced, they may not. So we're going to have to be flexible with that. And we may ask them, do you have another person in your environment that can do the videoing? In terms of like during a practical exam, it would be nice if I could say, hey, Scott, could you zoom in a little bit on Kendra's hands for me? So those are things I think that as faculty, we need to pay attention to. And I do feel the technology is there for some feedback that's real time, which would be beneficial. You can also have students upload their videos and give them asynchronous feedback in giving that, assuming they have a patient or something to move during that process. So those are my initial thoughts, especially from a psychomotor perspective.
So agree with everything else that's already been kind of shared. Again, as Mary said, I would say, you don't have to reinvent the wheel. There are lots of great resources out there, some free, some for a pretty nominal fee, subscription fee. As Mary mentioned, collaborating across different faculty. I'm a pediatric PT educator, so there's a lot of me out there that are all trying to figure out the same thing. And a lot of us have been talking to each other, because there's not any reason for all of us to be recording that same lecture, right? So this is a time where we can really think about how we can work together to try not to duplicate effort. Some things that I would think about, again, Mark, mentioned simplify. And I think another way to do that is to really think about, utilize principles of backward course design. So try to think about your course not in terms of content delivery, but in terms of learning. Start with the outcomes you want and work backwards, because maybe in this online environment, what that looks like is a little different than what it might have looked like if you were delivering it face-to-face. So again, that idea of backward course design and getting away from content and more on learning, I think is really critical. Again, knowing that we all have accreditation standards and certain content that has to be delivered, but really thinking about it in terms of design. I think humanizing, we've said this a lot, use as much video as you can, whether it's face-to-face or not face-to-face, synchronous. This feels video feels very face-to-face to me, but whether it's synchronous or asynchronous, there is a wonderful group of the California Community College has a great group that is, I think it's the Online Network of Educators, ONE, and they have some wonderful webinars and little short clips and a lot of it focuses on humanizing, and it'll introduce you to different tools you can use. Almost all of them are very free and accessible. So again, I think there's a lot you can do with video, and it's even for those psychomotor type skills. So, but you do have to be mindful if you're within your LMS that video files are really big. And so, recording a video and posting it in your LMS sometimes will overload that. So you might need to work with your institution's IT department to figure out, using it. At Baylor, we use Kaltura within Canvas for that streaming. But if you, for whatever reason, don't have that capability, there's tools out there. You could create a Facebook group for your class, and students can load videos, and you could load, you guys can interact in that way. I've mentioned Flipgrid. The Flipgrid, students don't have to have an account to use Flipgrid, but it's easy to access on their devices. And as an educator, there's a way you can give them private feedback in addition to the video discussion. So Padlet is another, it's sort of a free resource where you can curate content, and there's all kinds of people that use it in really interesting ways. I sort of use it as a Pinterest board for curating content, but I know lots of folks use it for uploading videos and for discussion, because it does have a social aspect to it. And I'm sure there's many, many more. Those are just a few off the top of my head. But again, thinking about using video to have students demonstrate the skill and you to give feedback, I think you'd be surprised at how engaging and rich that interaction can be. And then finally, the last thing I really am thinking a lot about is be thoughtful about access. Our students sometimes live, if they're back home, they live in communities that don't have access to really high internet speeds. That is what is required of video. They can't now go to the public library or to the coffee shop to get on fast internet because those public spaces are closed. So, and I worry a little bit that some of those pieces might disproportionately affect some of our students who are already struggling or who are from various disadvantaged populations, low socioeconomic status, out in rural communities, those sorts of things. So be really thoughtful with what you're doing, that you're creating as inclusive of a learning environment as you can. And again, making the ability to create alternative assignments or work with those students to make sure they're able to be successful if access is an issue for them.
Wow. That was a lot of really good tips there. That was a lot of strategy, a lot of thoughtfulness. And I can't thank you guys enough for taking the time to do this. I really do think our audience will hopefully learn a little bit from this. At the very least, we're just trying to do our part to help get the word out and spread the message. I know it is crisis time and a lot of uncertainty. So while we're holed up and quarantined, hopefully we can use some of the social media and digital marketing, or digital media rather, and podcasting and stuff like that to just spread the word on what's working, tips, tricks, things that we can do to help further education. So thank you guys all for your time and for coming on and for being flexible with this. Why don't we do this? I'll just allow you guys to wrap up and let people know where they can find you and where they can reach out if they have other questions or follow-up information. We'll go Kendra, Mary, then Mark, if you don't mind, and then I'll put all the links in the show notes for everybody.
Okay, so you can reach me via email at kendra_Gagnon@baylor.edu. I'm also on Twitter at KendraPeedPT.
Okay, and the best way to reach me is email maryb@nova.edu. But for those people that might be in crisis, I'm going to also put my cell phone out there. I don't know if I'll regret, but I don't think I will, because I think these are really challenging times for everyone. So my phone number, and I'd appreciate a text first, and then we can set up a time to chat, is 954-560-7670.
Yeah, I think, social media wise, I'm pretty active on Twitter. So my handle is at Shep, SHEP DPT. You can find me there. If you need, same with Mary, if you need me in crisis or what have you, shoot me a text, 276-608-5603.
Well, thank you guys so much, and we'll get this out to the public as quick as possible. You guys have a great and safe rest of the week, and look forward to talking to you guys once this is all finished up and things have calmed down a little bit.
Thanks, Scott. Thanks for having us.
Absolutely.